What do you want to know about them?
Why I have them.
Okay, all right.
So much.
Okay. Do you want to know anything else about them?
Where they come from, where they stem from.
Okay, so...
How to make them stop.
Okay.
That would be good.
Yeah, and then what else?
How to get this pressure out of my ear. That would be good too. Not related.
Welcome, this is Dr. Warren Kalkstein here in Baltimore, Maryland. I'm with Tegan.
Hey.
Tegan is a chiropractic assistant here, and she's training for her physical therapy assistant certification as well. And we're going to talk about cervicogenic headaches. If you just caught our conversation in the beginning, she was bringing up a couple things when I said, we're going to talk about cervicogenic headaches. She's like, yeah, I want to know what those are. I want to know why I have them.
Mm-hmm.
I want to know what to do about them. And if she didn't work here and get free service, in the back of her head, she'd be like, I want to know how much it costs to take care of it too.
That too, yeah.
So if you're a student, those are the things that people come in. They want to know what's going on. How does it get better? How can I get it better on my own? And how are you going to help me get it better? And what's the cost for that for me as a person or as an individual? What's that going to look like? So I can grasp my mind about expectations of care. So that's just a little side bit. But today we're going to be doing a clinical series. This is episode 1 of that clinical series. And let them know.
What?
You just said 1.
What?
Cervicogenic headaches. And there's 3 types of categories of pain stemming from a headache origin. You can get migraines, you can get cervicogenic headaches, and you get what's called cluster headaches. Each of those have different timings and different areas where people experience pain. We're going to talk about cervicogenic headaches first. Now, the name gives away some of the answers to where they come from. So cervical spine and origin is where these headaches stem from. And usually they're from the first 3 vertebrae in the spine, so C1, C2, and C3. And those structures that are associated with the spine, as well as the ligaments and the muscles surrounding those muscles, are what can cause or refer pain to refer up into the head, right? That's because of some of the accessory nerves that exit at the base of the skull and how pain can refer into different areas. So when someone comes in and says, I have a headache, and I'm thinking in the back of my mind, potentially it can be cervicogenic, what does that mean, right? Cervical spine pain can refer into the base of the head here. It can refer out to the side. It can refer into the ear. And it can refer over into the eye, or over into the forehead. So if they're describing some of those pain patterns, right? And then their history is also really important when it comes to where is this pain coming from? Where is this headache coming from? So repetitive stress is one thing that can cause a cervicogenic headache. So if students are sitting like this all day long, they notice towards the end of their study habits that they're starting to get a headache coming on, they're staring at the computer screen, they're straining their neck in that position, that can be a source of a cervicogenic headache. So chronic stress or poor posture coupled with that chronic stress. So that's one thing. Minor traumas, whiplashes, or playing a sport or activity where the neck is being used excessively, like football or lacrosse. If someone comes in, they're a heavy hitter, and they're talking about getting headaches, I want to look at the suboccipitals in the neck to see if that's somewhere that can be causing that referred pain, right? Those are the 2 primary causes of cervicogenic pain. So we're looking at chronic stressors, like postural stressors, and then we're looking at micro traumas where people are getting into a little bit more physical positions. That would be the 2 primary sources of cervicogenic headaches. And stress and daily habits can also lead to these things and exacerbate them a little bit more. But primarily when we talk about pain referring from an area, it's from the cervical spine, C1, C2, and C3. So what can you do about it? There's stretches that you can do for the neck. Let's show them forward neck stretch. So if you bring your chin down to your chest, your elbows come together, and you roll your head forward, you'll feel a pull in the back of your neck. You take a deep breath in, you exhale, let your head fall, you'll feel that stretch increase. Do that again, breathe in, and then you exhale, you bring your elbows together, you feel a pull right down the middle. Good, and then take another breath in for me, and then last exhale, let it really fall. Good job. All right, now sit up nice and tall. That's an easy forward neck stretch for the muscles, right? Another stretch that I'll show you is just a little bit different. You're going to take one hand behind your back, and the other hand is going to come in the front, and you're going to aim your chin to your opposite hip. So I'm aiming my chin to my right hip. I'm pulling down. I'm letting my elbow gradually pull my neck down with my left arm, tucking behind. What that does is it pulls the shoulder blade out of the way, and it elongates that stretch on that muscle that connects your shoulder blade to your neck. So that's another stretch. 3 easy breaths, and you can do both sides with that, okay? And finally, the active motion is really important for those muscles, or excuse me, those joints that we were talking about. So chin translations is another one. So can you show Liam chin translations? Or I'll show off with these, and you can kind of coach me through them. So I'm going to bring my chin back.
You're going to be like on a railroad track.
On a railroad track. I'm not going to tilt my head up.
Nope. Straight back.
Straight back.
Yep. And you're just going to leave it there and bring yourself forward again. Making sure it's coming straight back on that train. You don't want it to extend up too much. Not lift. Lifting is not good. And if you think you look pretty doing them, you're doing them wrong.
There you go. That's the biggest thing. So
aim for that double chin.
Triple
Chin?
Quad. Me. So you'll feel that pressure build up right below the base of your skull when you do this correctly. You'll feel the stretch occur at the joint. This is very effective when done correctly and done slowly for relieving some of that tension at the base of the neck, okay? And then we show you how as a chiropractor I'll assess and look at for cervicogenic headaches. First I'll look at range of motion in the neck. I'm going to take a look at passive range of motion in the neck, which means where she's not doing anything but I'm taking her neck through that range of motion, and then I'll palpate the joints. So go ahead and face me, okay. Arms down by your side. Turn your head to your right for me as far as you can go. Good, and to your left. Good, and face me. Head straight back. Good. And chin down to your chest. Good. Back up. Go straight back again for me. Turn your head to your right. I'm going to put some pressure. Is that uncomfortable?
Yeah, a little bit.
Okay. I'm going to bring you here. I'm going to push back. Is that uncomfortable?
Yeah. Pretty equal on both sides.
And where are they when that hurts?
Pinch like right in there.
Okay.
Yep.
I'm going to bring the table up. We've been treating Tegan at the office from time to time. She's had a history of some headaches, and recently she's had a little bit of a spike in them. So let me show you how I would adjust the neck. Come up on your back for me. Good, and relax back. Where's your ear pressure, Tegan?
It's like in my ear, like inside of it. And depending on what position I'm in, it kind of triggers it. It's weird. I noticed it last night when I was sleeping. Oh yeah, that's tender.
So muscles that are associated with those 3 vertebrae that I was talking about, when they become hypertonic or constricted, doing some soft tissue work over that area can help relieve some of the tension that can cause cervicogenic headaches. And she has a group of muscles here that are quite restricted on the right side. I'm going to have you turn your head to your left all the way. So I use a form of pin and stretch to help alleviate some of those symptoms.
I can like feel that in my ear when you press there.
So when it comes to finding the origin, if I can get a change in the symptoms of the while on the table, that I know I'm in the right area, I know I'm treating the right systems, and that's really important. So when I put pressure over these muscles, there's a group of nerves that exit over that area. So lesser occipital and greater occipital nerves and auricular nerve are going to be associated with that higher cervical spine. So if I can palpate slowly over the base of the skull, and when I get to an area that's restricted and tight like this, and she has an increase or she feels the symptoms, I know I need to work that tissue to relieve the tension over that area. Now, in terms of what you can do, you can ice this area at home. You can do the stretches that we talked about. You can make sure that when you're doing your homework or you're going through your daily routine, your posture is good. That's really important. You can make a difference just by being aware, right? That's important. A lot of times that if you go into a situation where this is severe and you go and you have imaging done and it's negative, right? Most of the times imaging is not warranted in this case without conservative care first. What is the treatment from the other side of the field, right? Or from the side of the field that's a little bit more allopathic. and that would be muscle relaxers, that would be anti-inflammatories, education. There's not going to be a lot of manual work done if you were to say go to an urgent care. But this really makes a huge difference with our patients when we treat the source of the problem. So soft tissue work over the base of the skull gets that area to loosen up for me. Now I go a little bit deeper and I check palpation of the cervical spine joints. I want to see an extension how she moves, lateral flexion how she moves at those levels, and I travel my fingers down at C0, C1, C2, and C3. C0 joint, that is. So when I palpate in 2, C0, C1, C2, when I go to C2, she's restricted at that level in lateral flexion with rotation. So let me show you how I adjust that. Here, loose. Good, relax your shoulders. Good. Okay, Leo, let me step over there. Loosen your shoulder. Good. Relax. Now turn your head all the way over to the left. Good.
Keep it there?
Yep.
Okay.
So she's got a ton of earrings and all kinds of stuff here. It makes it a little bit more difficult for this adjustment, but just try to relax. Good. Good. Good.
Ooh, that's interesting.
A little deep pop.
Yeah.
Turn your head to your right for me. Good. Hold here. Reach across, hold on to my opposite shoulder. I'm checking her upper thoracic spine. Good. Take a breath in. And easy exhale. Just an easy compression over that area. Good. Gentle first rib adjustment. Okay. Tegan, how do you feel?
Relax. Good.
Good. So again, we talked about where headaches can stem from, and there's 3 categories: migraines, cluster headaches, and cervicogenic, right? When it's cervicogenic, it's usually coming from the first 3 structures in the cervical spine: the first, second, and third vertebra, the ligaments, and the muscles associated with them. You watched how we did some soft tissue work on those muscles. We talked about different things that you can do at home, like the stretches, the icing at home, 10 minutes of ice on your neck. And then the type of other care that you can get if you go, say, to an allopathic or an urgent care. What's going to happen if you do that, right? Usually imaging is not needed in this type of situation, and usually all you need is some manual therapy over the base or the muscles in the neck, as well as adjustments to those areas that really clears these things up really well. And now you get to go back to work and have some fun. Your hair looks amazing, so you're welcome.
Thanks.
So if you have any questions about cervicogenic headaches, or if you have friends that are experiencing those, tag them below and let them know that this is there's some ways that you can deal with it on your own. Being aware of your posture is really important too. And then if you need a chiropractor, reach out into your area, look on Google reviews, find a good chiropractor near you to get treatment for this type of thing. It's really, we got to get going back to work. It's something that you can handle and take care of in an active way, and not just take medication for. So if you have any questions, post below. Thanks for watching our first episode.
Thanks for watching.